Mock IRB review process, Amy Mata, Social Work 9030, Dr. Ferreira. Her study title, Understanding Emotional Impact, Distinguishing Secondary Traumatic Stress, Compassion Fatigue, and Vicarious Trauma in Heart Transplant and Mechanical Circulatory Support Healthcare Workers. Good morning, I am Amy Mata. I'm a licensed social worker and doctoral student at Tulane University School of Social Work. I'm conducting my study alongside my colleague Megan Maltby. This study examines how healthcare workers involved in heart transplantation perceive and differentiate between secondary traumatic stress, compassion fatigue, and vicarious trauma. We are particularly focused on the impact of these experiences on emotional well-being and professional sustainability in a high acuity area. Potential conflicts of interest or incentives. We do not have any disclosures to report. The purpose and research question: in high-intensity care settings like heart transplant and LVAD programs, healthcare staff face emotional and psychological strain. Secondary traumatic stress, compassion fatigue, and vicarious trauma are inconsistent and overlap when describing the emotional toll these professionals experience. This conceptual misinterpretation affects literature and healthcare staff assessment and assistance. I want to explain how these conceptions vary conceptually and practically. I think this will help identify and focus mental health interventions for these professionals. The central research question guiding the study is: how can secondary traumatic stress be conceptually and empirically distinguished from compassion fatigue and vicarious trauma in healthcare workers? Target population. For this study, the target population includes healthcare professionals at VCU Health who are directly involved in the care of patients receiving LVAD or heart transplant services. This encompasses a wide range of roles, including cardiology and cardiothoracic physicians and surgeons, cardiology and cardiothoracic nurses, transplant and mechanical circulatory support coordinators, allied health staff, ICU physicians, and residents. To ensure participants are emotionally prepared for this task, inclusion criteria needed individuals with at least 6 months of continuous experience dealing with LVAD or transplant patients. Schedulers, billing coordinators, and administrators are excluded since their experiences may not represent the same emotional intensity or clinical commitment as direct patient care. Recruitment and informed consent. Participants will be recruited from VCU's health, thoracic, cardiac specialty units. As one of the primary investigators, Megan will lead recruitment efforts along with myself using unit-specific email listservs to distribute a standardized recruitment email. This email will include a brief study overview, eligibility criteria, my contact information, as well as Megan's, and a secure link where interested individuals can express interest in participating. Once a participant indicates interest, they will receive a written informed consent form prior to any data collection. Consent will be obtained electronically using a secure IRB approved platform. Importantly, participants will have the opportunity to ask questions and receive clarification before providing consent, ensuring that their participation is fully informed and voluntary. Data collection methods. The study will collect quantitative and qualitative data using mixed methodologies. First, participants will take a quick demographic survey to determine eligibility. This ensures all participants meet inclusion criteria and gives a professional overview. Participants will then be invited to a semi-structured interview to discuss their role-related emotional distress. Zoom or in-person interviews will be conducted based on participant preference and availability. The total time commitment for both the survey and interview will be approximately 60 to 75 minutes. Privacy and confidentiality protections. Safeguarding participant privacy and confidentiality is paramount in this study. All participant information will be maintained in absolute confidentiality. Data will be designated by ID numbers instead of names, and no identifying information will be used in transcript reports or publications. Audio recordings of interviews will be securely maintained and disposed away upon completion of describing. Before analysis, all data will be encoded and anonymized to enhance participant confidentiality. Potential risk and mitigation. Safeguarding participant privacy and confidentiality is paramount in this investigation. Our participant information will be maintained with absolute confidentiality. Identification of data will utilize ID numbers instead of names, and no identifiable information will be included. and transcripts, reports, or any publications. Ultimately, all physical data will be preserved in secured cabinet within Megan's office, guaranteeing restricted, safe access.